It's estimated that over 232,000 women in the United States will be diagnosed with breast cancer this year. Florida Hospital Waterman has been raising awareness for breast cancer in a unique way by turning its canopy an iconic fountain pink for the month of October. The specialist at Waterman's Digital Mammography Center explained that early detection is a year-round responsibility for all women.
It's very important to do monthly breast self-exams. It's very important to adhere to the screening guidelines because this helps result in early detection and better outcomes.
The American College of Radiology and the American Cancer Society routinely, for screening for prevention of breast cancer, recommend a mammogram at the age of 35, followed by a mammogram at the age of 40 if everything's okay at 35, and then yearly mammograms to the life expectancy of the patient. For patients who are high risk, meaning like maybe their mother, grandmother, aunt, maybe they have 2 or 3 relatives, I even see them at the age of 30 or 32 just to get a baseline. Self-examination is a very important tool in addition to the mammograms. What we recommend, and the American College of Radiology as well as the American Cancer Society recommends, especially from the age of 40, a monthly self-breast examination and a yearly physician breast examination in addition to the mammograms. Because there are some cancers that are picked up by self-examination earlier rather than waiting for the yearly mammogram. All women should be doing it every month.
I think it's very important to increase public awareness of breast cancer, how important it is to detect it early, which is reflective of better results and reducing mortality, and that's our aim.
If the doctors haven't impressed upon you enough the importance of early detection and annual screening mammograms, Nora Fullerton, one of Waterman's breast cancer patients, will.
I have not been doing self-checks enough. I should have been doing it more. I'm sure I would have found that lump much sooner because it was quite big by the time I'd found it. So if I had been doing breast exams, I think I would have found it sooner. It'd been 3 years since my last mammogram, and I know now I should have come sooner. I thought, oh, I've got a lump, I'll find it myself. But obviously if I'd come sooner and not left it 3 years, I might have been in a lot better condition. Maybe I wouldn't have had to have all the chemo and all the radiation. Maybe they could have removed the lump and been done. I went and had the mammogram, and it really didn't worry me too much because I've had a lot of fibrocystic lumps, so no big deal. But then they wanted to do a biopsy just to check on that. So we went in, and of course they told me I have some sort of nasty cancer. To the women out there that don't go and have their breast checked, please do, because I didn't, because I have no criteria whatsoever to have this breast cancer. I was not the right age, many things. I don't have the family criteria, nothing. Don't assume that you're okay and go and have the mammograms. They're so much better than they used to be. They do a much better job, and it's better to find it sooner than later.
Designated Lake County's first breast imaging center of excellence, Florida Hospital Waterman provides complete imaging, diagnostic, surgical, and support services for breast cancer patients. The specialists want you to recognize early signs that may indicate you have a tumor, a lump or thickening in the area near the breast or underarm area, a change in size or shape of the breast, dimpling or puckering of the skin of the breast. The skin could be pitted or ridged. Fluid discharge from the nipple, especially if it's bloody. Scaly, red, or swollen skin on the breast, nipple, or areola. We've included a list of websites with more information on breast cancer, as well as contact information for Waterman Digital Mammography when you click on Raising Awareness on our homepage, yourhometownhealth.com.